Hi, I'm Dr. Kenja, and I'll be presenting for this month's Brunch and Learn. But before I get started, allow me to tell you a little bit about The Qualified. The Qualified, we're an educational support service that assists HIM professionals in becoming certified, staying certified, and hiring qualified. Become Qualified is our exam prep department that consists of one-on-one tutoring and coaching, as well as offering online courses to help HIM professionals earn select certifications from AHIMA, AAPC, and HIMSS. Our Stay Qualified department wants to help our audience become qualified and stay qualified by helping them maintain their certifications and earning the necessary CEUs through our Continuing Education Center. Higher Qualified is our staffing and recruitment services. So you'll find that we advertise HIM positions, and we help employers find the best candidate for their positions by referring from our pool of qualified candidates. So if you're an employer, please be sure to connect with us and let us know your hiring needs. If you are a job seeker, we encourage you to do the same because we want to help you find the position that you're looking for. Okay, so let's get started. As I mentioned, I'm going to be presenting Making the Right Choice, Ethics in Healthcare. This is a non-clinical perspective. Allow me to say that I appreciate you taking the time to join me for today's CEU event. You could be anywhere else. Allow me to also say that AHIMA is offering a free webinar worth 1 CEU on ethics. So if you're interested, I'll be sure to drop the link at the end. I took the time to complete it just to make sure it was a little bit different than what I was putting together at the time. All right, so in this presentation, I want to accomplish the following. First, we're going to define ethics, morality, and 2 common ethical theories and principles. We're going to discuss ethics in healthcare. We'll review the code of conduct that governs HIM professionals to evaluate essential ethical skills and standards of professional practice. We'll evaluate ethical issues that arise at HIM. We'll then determine areas of personal and professional bias that inform HIM practice, including the influence of culture and diversity. And then lastly, we're going to utilize an ethical decision-making tool to analyze a few ethical issues to help and make some reasoned decisions. Okay, so HIM professionals were guided by a code of conduct and a professional code of ethics. Ethics can be defined as a set of principles regarding business practices and professional behavior. So ethics itself is the field of study addressing moral principles, theories, and values. Morality, also known as our moral values. That's the general term used to describe norms, duties, manners, or customs that people use to distinguish between right and wrong. A moral dilemma is a situation in which there is a decision to be made, but any choice may violate some other duty or standard because the right thing to do may be hard to choose or unknown. Making a mistake or error in judgment that results in a harmful effects relative to your typical ethical standards, that's referred to as an ethical lapse, or you'll hear people say, I had a lapse in judgment. A moral agent is a person that's responsible for making a decision, whether it be for themselves or for other people. Moral distress is when someone feels compelled to act contrary to their moral beliefs or requirements. And then lastly is going to be our moral courage, which is defined as the personal trait of individuals who act upon their ethical values to help others, despite there being a personal risk, some type of adversity, and or professional isolation. So let's talk about two common theories that you may be familiar with, whether it be from your textbook or in school. So one is deontology. Deontology holds that what is right and good in terms of morality is ultimately determined by the moral agent's actions and their intentions relative to their duties and obligations. So doing the right thing without thinking of any consequences. Okay. And then next is utilitarianism. So, according to the utilitarian theory, an act is moral to the extent that it produces happiness. And the moral correct action is that which creates the greatest and most good for the greatest number of people. All right, so let's look at some ethical principles. Ethical principles helps us with our overall decision making. So in healthcare, you may find that we use some of these principles, or you may hear some of these words or principles. So in healthcare, we tend to use autonomy. Let me jump to the middle really quick. I won't go in any particular order, but autonomy refers to an individual's right to determine what does or does not happen to him or her in terms of their healthcare. So I also want you to think independence, right? Whenever you hear that word autonomy. Beneficence. Look at that word. If you cover up the back half of it, you should see the word benefit, right? Without that T, of course. But beneficence is a term that refers to the moral obligation of promoting good for or providing services that benefit others. Okay. So whereas beneficence requires us to promote good, prevent harm, and remove harm, non-maleficence is the opposite, or allow me to say it requires us to refrain from actions that causes harm and refrain from inflicting harm. The principle of justice, that refers to the fair and equitable treatment of all people, considering what is owed to them. All right, so ethics in healthcare. I'm going to cover some general professional values and obligations. So, the general values and obligations or underlying values that healthcare professionals know to follow, right? Or it's ingrained in us, is that overall respect, integrity, leadership, and quality. We try to make it a point to lead with those values, or act in accordance to those everyday values. So there are several ethical issues that can arise in healthcare, okay? Ethics concerns can arise if it's not clear that, let's say, a patient was incapacitated, or physician-assisted suicide, or doctor-patient confidentiality. So first, let me say, I just said a couple things that I really want to touch on. I mentioned physician-assisted suicide. This has been prominent in the news. And just so you know, that physician-assisted suicide is mandated by state law in Colorado, District of Columbia, Hawaii, Maine, New Jersey, New Mexico, Oregon, Vermont, Washington, and then it's mandated by court ruling in Montana and California. Okay. I also mentioned ethical concerns can arise when it's not clear if a patient was capacitated, right, to choose whether or not they want a DNR, right, a do not resuscitate. So when I said that, I immediately thought of a case that came up or presented itself in Florida back in 2017. So I'm not sure if you guys follow news in Florida, but we tend to use the term Florida man, right? But anyway, in the case of this Florida man who was rushed to the hospital, he was unconscious. He had a do not resuscitate tattoo across his chest. And of course, that caused the hospital staff to have questions, right? Is this just a tattoo, or does he really mean that he doesn't want to be resuscitated? So what I thought was interesting was that not only did he have that big do not resuscitate tattoo, he also had a signature underneath. And then do not was underlined. So I thought that was very interesting. And no, we couldn't scan that into the medical record, but I think that it's safe to say that his intentions or his wishes were clear, right? So what we found out later was, the man was 70 years old. Again, there was an underline. So he really meant what was tattooed on his chest. And I thought it was cool that the doctors and the nurses decided to honor his wishes. Okay, so outside of those issues that can arise in healthcare, let's look specifically at HIM, okay? So I mentioned that there are some general professional values and obligations. We follow that in HIM too, right? But then there's also the protection of privacy, the maintenance of confidentiality, information security, that we also follow, right? Then we have our professional code of ethics, and then we also have to navigate some ethical decision-making when it comes to HIM. So allow me first to touch on that protection of privacy that I mentioned. So that basically means that there is freedom from unauthorized intrusion in healthcare, right? Including the right of a patient to control the disclosure of their protected health information. Like, we know as HIM professional, we have a duty, right, to keep this information protected and to keep it private. Maintenance of confidentiality. So confidentiality is a legal and ethical concept, okay, that requires healthcare providers to protect health records and other personal and private information from unauthorized use or disclosure. Okay. Assurance of data and information security. These are security controls used to access and protect information from accidental or intentional disclosure to unauthorized persons and from unauthorized alteration, destruction, or loss. Okay. So now let's get into some of those other things that I mentioned. In case you aren't aware, all right, we have a code of ethics that provides guidance for HIM professionals, which I'll cover now. The AHIMA Code of Ethics is relevant to all AHIMA members and credentials HIM professionals and students, regardless of their professional functions, the settings in which they work, or the populations that they serve. So the AHIMA, they have a couple different versions, right? Not of ethics, but They have a general code of ethics. Then they have the standards of ethical coding. And then we have ethical standards for CDI professionals. So allow me to cover each of those. Okay. But I really encourage you to bookmark those standards and review them at least once a year, just to make sure you keep it at the forefront of your mind. Or let's say you are a HIM director or coding manager, or you're just in some leadership position. I think that it's important to task our team with reading the code of ethics. Or if you are mentoring or you allow volunteers in your department, making it a part of your orientation, okay? So the AHIMA Standards of Ethical Coding is intended to assist and guide coding professionals, whether credentialed or not, okay? Including but not limited to coding staff, auditors, educators, CDI professionals, and managers responsible for decision-making processes and operations, as well as HIM and coding students. So the standards outline expectations for making ethical decisions in the workplace and demonstrate coding professionals' commitment to integrity during that coding process, regardless of the purpose for which the codes are being reported. So let's say, for example, you're coding charts that are used for research, or you're coding for research purposes. That doesn't mean that you're not going to follow the coding guidelines, right? Or you're not going to say, well, I'm not going to take this serious. I'm not going to code everything. I'm only going to code the biggest diagnoses. No, you need to code that chart the way that you're expected to code that chart in the most ethical way, regardless of the purpose, okay, that record or that information is being used. I know certain hospitals, like, they don't bill certain cases, but either way, coding those cases. Okay, so ethical standards for clinical documentation professionals is intended to assist in decision-making processes and actions, outline expectations for making ethical decisions in the workplace, and demonstrate they are relevant to all clinical documentation improvement professionals and to those who manage the clinical documentation improvement functions, regardless of the healthcare setting in which they work, or whether or not they are AHIMA members or non-members. So if you're a CDI professional and you're not credentialed, or you're an RN, you would still be responsible for following these code of ethics, right? Because you're not an AHIMA member, but you're a CDI professional. Or let's say you hold the CCDS credential through ACTIS. You're still responsible for following these codes of ethics, even though, ACTIS may have their own. So just keep that in mind, okay? And then also here on the slide, I have AAPC. AAPC have their own codes of ethics. So I think that it's important to read those if you hold AAPC credentials, okay? And the same for HIMSS. Okay, so some common ethical dilemmas in HIM. Medical records and other health information can contain personal data, okay, such as your health condition, substance abuse issues, sexual history, psychiatric diagnosis that can prove harmful or embarrassing if released to unauthorized users. So some common ethical issues that I've seen in HIM tend to relate to documentation, release of information, or coding. So when it comes to documentation completeness is a big one. So the completeness of medical records, as you know, is essential for continuity of care, quality improvement, as well as legal purposes. So HIM professionals may face ethical dilemmas when they encounter incomplete or inaccurate documentation, and they must decide whether or not to report it, to request clarification from the physician, or to make assumptions. I personally remember a case that I encountered years ago where a patient's family was suing the hospital that I worked for because something went wrong during an operation. And the physician chose not to dictate that op report. So when the family came to request the medical record, that record was closed for months, right? So that op report was delinquent and it wasn't on there. So of course, that's what they were looking for. So what do you tell a family in that situation, right? Lawyer requests the records. That op report is still missing. So it really does put us in compromising, or it can put us in compromising positions. And then also, as you know, like let's say, for example, you're a coder, you can't necessarily code a record, or you may not be able to accurately code a record if certain documentations are missing, right? If that record doesn't have a discharge summary or that op report, that record is going to be outstanding on that DNFB, and it holds up that coding and billing process. So that's another example for that documentation completeness. When it comes to release of information, patients have a right to access their medical records, but HIM professionals, we must balance that with the need to protect the confidentiality of patient information. So there may be ethical dilemmas related to releasing sensitive information or deciding when to deny access to records. So when it comes to coding accuracy, as I just mentioned, ensuring that medical codes accurately reflect the diagnosis and procedure performed is critical for appropriate reimbursement and patient care. However, there may be pressure to inflate codes to increase reimbursement or to unbundle to avoid scrutiny. I've seen it both ways. So HIM professionals, we face ethical dilemmas when trying to balance accurately coding with those external pressures. So I think the first thing I want to say is just be aware, pay attention, and just be careful, right? So now I want to take the time to go over a couple different scenarios to help you decide what to do or things to consider if you're presented with similar scenarios. Okay, so scenario one, a patient requests access to their medical record, but they're not able to understand the information due to language or literacy barriers. What would you do? All right, I hope you had a second or so to think about it, but patients have a right to access their medical record under HIPAA, but organizations also have the responsibility to ensure that the information is understandable to the patient. So in this case, you could work with an interpreter or a translator to explain the information to the patient. So most facilities now have those translation lines, excuse me, that they can dial into or that may be up on the floor to easily translate the information to the patient. You could also provide a written summary or an explanation of the information in the format that the patient can understand. And the translator can help you with that too. So it is important to document your efforts to provide the information in a medical record in a way that the patient can understand. So not only that, allow me to say that, back in the day, we would get a coworker, or family member and ask them to translate on our behalf. I do encourage that we no longer use that practice, especially when it comes to healthcare, because we don't know whether or not they are accurately translating the information or the context, right? We don't know if they are saying it in the way that it was intended to be said. So I want to encourage you, if that's something that you're still doing, try and move away from that practice and really see what other resources your organization has to help you better communicate if you're responsible for doing such in your organization. Okay, so scenario 2. You receive a request for information from a family member of a deceased individual who needs access to the records to provide it to the life insurance company with hopes of getting the funds before the home goes into foreclosure. What should you do? Okay, so what stood out to me in this scenario is the urgent need, right? And sometimes that triggers something in my mind because you don't need that amount of pressure. The family cannot make their emergency your emergency or your problem. So just be careful with that, right? They are rushing you to make a decision. Like, we need this today, right? Because if we don't have it, this is going to happen, or we're not going to get the money that we need. And it's going to cost us to lose our house, things like that. So don't allow patients, or anybody for that matter, to rush you into making a decision or to back you into a corner where you feel pressured to violate somebody else's privacy or to violate privacy. And don't think that because this person is no longer alive, you aren't violating their privacy, right? So the HIPAA privacy rule, it protects individually identifiable health information about a decedent for 50 years following the date of death of the individual. So that's well beyond our retention period, right? So just keep that in mind. And then there's a process to follow. If it's a family member, every facility is different. So don't think this is the end all be all, right? Or the gospel. Know your facility policy is what I'm saying. But when it comes to family members, when requesting records for a deceased individual, we require them to have a death certificate in hand, right? That death certificate has a spot for the next of kin. So we tend to take that, we'll look in the medical records, see if that next of kin matches. If it matches, okay, we know that we are safe to provide information. I'm not going to say all information, but we can say that it's safe to provide them with information that they need. Okay. However, let's say that next of kin is somebody else or something different, or there isn't one in the record. Okay, so we can't provide that information. So the next thing would be the family would have to get a court order signed by a judge appointing the individual as that executor of the state in order for, us to release that information. Okay. So as I mentioned before, check with your facility just so you're comfortable in that regard, because some may not even accept the death certificate, with the next of kin provided. They may straight say, we need a court order signed by a judge. Okay. But either way, the individual or that family member must still complete and sign an authorization. We'll still need a copy of their ID, right? The copy of the death certificate or the court order must also be kept in the medical record. Okay, so let's look at this last scenario together. A physician asks you to begin capturing a procedure that was not performed, but they technically perform it on every patient anyway. The practice needs the additional money so that they can begin paying everyone in the office what they deserve. What would you do, or what should you do? Okay, let's look at the scenario. Okay. They want you to begin coding a procedure that wasn't performed, but they technically perform this on every single patient anyway, right? So is it documented? If it was documented, most likely you would pick it up, right? But if it's not documented, then what? It didn't happen, right? So that's a conversation that needs to be had first. So if this is something that you're doing on the patient, then it needs to be documented, okay? Next, allow me to say that if it's not documented, right, it didn't happen. So them asking you to code it or capture it, that's fraud. So you want to be careful there. That should definitely present a red flag for you. Okay. HIM professionals, we have a duty to code accurately and ethically. So it would be inappropriate to code a procedure that wasn't performed. Okay. So you could explain that to the physician. You could explain that coding must reflect actual services provided and that it's unethical and illegal to code inaccurately for financial gain, regardless of why they want you to start doing it, right? And then they're trying to entice you with getting higher pay or getting more money so that they can pay you more. But that shouldn't entice you by any means. As I mentioned, that should be a red flag. And if the physician persists in asking you to code inaccurately, I suggest you quit. I suggest you quit because on the flip side, right, even if you don't quit, what if you're fired for not doing it? I don't want anybody to ever have regrets, right? Because then that ultimately puts you in a bind. Now I have to find another job. How am I going to pay my bills this month? Should I have done this in order to keep my job? No, it's not worth your integrity. It's not worth losing your credential. So don't even consider it. Remember earlier, I mentioned having that moral courage, right? Sometimes it can isolate us professionally, or doing the right thing without thinking of the consequences. I'm not going to do this, regardless of if that means I'm going to lose my job, regardless if the people in the office are now going to look at me funny or look at me sideways because they think that I'm not doing my job accurately, or they think that I'm the reason why they're not getting paid more or getting that pay increase or that bonus because I'm refusing to do my job correctly, or I'm refusing to partake in such illegal activity. Don't put yourself in that situation. And I use this scenario because, seasoned professionals, they may know, no way, I'm not dealing with this. I know the signs, right? I know, but I'm thinking about new professionals, right? Sometimes we get so excited to land that first job, and sometimes we don't know, is this typical? Is this not typical? They're questioning my coding. Am I doing something wrong? Or are they trying to get over on us? Or they're trying to get us to do something wrong? So I would hate for anybody to be in that situation. So you have to be careful. I also want to say that sometimes practices, they don't always value the knowledge of the HIM professional. They may not even have or aren't used to having HIM professionals on staff. So when we give them pushback, it's not always taken lightly, right? But just know that we have guidelines for a reason. We have guidance for a reason. So use that to your advantage, okay? And use that to back up your decisions. Okay, so let's talk a little bit about personal and professional bias. First and foremost, we have to acknowledge and we have to address. HIM professionals, we work with sensitive and personal health information, and it is crucial to recognize and mitigate any personal and professional biases that may influence our decision-making process. So the following are some areas of bias that can impact or affect HIM practice. So first is going to be that cultural bias. So cultural bias can influence HIM professionals' understanding and interpretation of health information. For example, different cultures have different attitudes towards health and wellness, and understanding these cultural differences is important to ensure that health information is interpreted correctly. Gender bias. Gender bias can affect HIM professionals' understanding of health information too. It can lead to inaccurate assumptions or stereotypes about certain genders and their health behaviors, which can impact the care provided to patients. I used to hear people say all the time, well, males don't like going to the doctor, or, these are stereotypes. I see males in physician offices or in the doctors all the time. Sometimes it may not be their first step, right, or first choice, but I think we don't want to put information or inaccurate information or assumptions or stereotypes out there like that. That can be dangerous, especially as healthcare professionals. Racial bias. Racial bias can also influence the interpretation of health information. HIM professionals, we need to recognize and address any implicit bias that that we may hold personally and professionally to ensure that all patients receive fair and equitable care. I mean, at the end of the day, that's what it boils down to. Professional bias, right? That can occur when HIM professionals, we rely too heavily on our own professional opinions and expertise without considering other people's perspective or evidence-based practice. Our experience isn't the only experience. Our perspective isn't the only perspective. This is why there's best practice, right? This is why there's evidence-based practice and evidence-based medicine, because we have to sometimes rely on that information, or we have to use it in order to make informed decisions. So to mitigate biases, HIM professionals should be aware of our own bias again, and we must work to address them. We can also seek out training, whether it be from our organization or somewhere else in our community, um, on cultural competence and diversity to better understand the different perspectives and the needs of our patients of different backgrounds. Additionally, HIM professionals, we can strive to incorporate evidence-based practices into our work to reduce the influence of personal bias. Okay, so when it comes to ethical decision making, these are questions that I want you to consider, okay? Or always ask yourself, what is a moral dilemma? Or what is the moral dilemma? What are my assumptions, my biases, my emotions, and my values? What are the facts? We always have to start with the facts. What do we know about this situation? What are our stakeholder values? Addressing all of that is going to help us determine now what are our options. What can we do about this situation? How can we handle this situation? What options do we have? And then what is the chosen course of action? And then what policy can mitigate or preempt this issue? That alone has saved me personally so many times, because I think when we're in these positions and we're making these decisions, we're so worried about not being the bad guy, right? Or not being the bad girl. That's not the point. We have to, we can't take it personally, but sometimes it helps to have that armor. Sometimes it helps to have that policy or that backup to say, you know what, this is not my personal decision. It's right here in black and white. So I hope that helps. All right. And then again, I mentioned, depending on our role, depending on the decisions that we have to make, ultimately, we have to take that personal accountability. Okay. So what does that mean? I like to say that there's 4 steps to personal accountability or taking accountability. One is mustering the courage. Remember earlier, I said moral courage, having that moral courage. So mustering the courage to see the ethical dilemma or knowing that one exists. 2, finding the heart to own it and to say something about it. 3, having the wisdom to solve it, right? And don't feel like you have to solve it right there on the spot. Let me go ask somebody. Let me go do some research. Has this ever come up before? Don't feel pressed to make a decision right then and there. I'm not quite sure how to handle this, but I'm going to get some guidance. I'm going to find out, and I will get back with you. Yeah, they may not like it, but that's okay. Because at the end of the day, you're doing your job and you're protecting the information that you need to protect. And then lastly, you have to exercise the mean to do it, right? And when I say to do it, I mean to solve the problem, to make a decision. All right, well, I hope that you found this to be helpful. Okay, so for those of you who know me, I refer to myself as the HIM certification coach. That being said, I just want to take an opportunity to share where ethical concepts and principles are covered on select HIM certification, because they are there, right? And then you might find that there are some behavioral-based questions to see whether or not you know how to act ethically or how to make ethical decisions, okay? So if you are looking at achieving an AHIMA certification, if you're looking at taking the RHIT, domain 6 is on leadership. It represents 9 to 12% of the exam. Ethical questions fall underneath that domain. If you're looking at taking the RHIA, domain 5, management and leadership, that represents 15% of the exam. There are ethical questions and concepts in that domain. Another domain in which, or another exam in which you'll see ethical concepts is going to be the CDIP, domain 2, education and leadership development. It represents 21 to 26% of the exam. So if we're looking at HIMSS certification, both the CA HIMSS and the CP HIMSS have the management and leadership domain. For the CA HIMSS, it represents 14% of the exam. And for the CP HIMSS, it represents 25% of the exam. So don't think that, this information won't ever come up. So even outside of the department, right, it will present itself in other ways, such as on those certification exams. So if you want to go over some scenarios, behavioral-based scenarios, or talk through some more of these ethical scenarios, you can reach out to me, right? Or even at your organization, whether it be your privacy officer, whether it be your compliance officer, you should be able to get some guidance there too. But thank you so much for taking the time to listen to this presentation. I hope that you found it to be helpful. Here is my contact information. You can connect with me on LinkedIn. Please be sure to connect with the qualified and to subscribe to our YouTube channel for other information or for other brunch and learn opportunities. We look forward to seeing you again. Okay, I'm going to leave this up here in case you want to write this down. Again, we're on LinkedIn, we're on Facebook, we're on Instagram, but we are also on YouTube. Please subscribe to our YouTube channel.